I'm Dr. James Chiarotto.
I'm Akbarali. Exercise can help patients feel better and has been shown to possibly reduce the incident rate of cancer.
But is it a cancer treatment? We created an exercise program for my patients with metastatic incurable cancer on chemotherapy. And we tested beta-catenin as a biomarker for exercise-induced survival for my patients with metastatic colorectal cancer.
We gathered participation data and tested for such things as fitness, fatigue, as well as quality of life.
And we tried to understand selection bias.
So let's get into it.
124 patients in my general oncology practice were candidates for this pilot. Table 1 shows the breakdown and includes the primary tumor type, the number of patients of each tumor type referred, and the number who accepted. This table shows reasons for non-participation in our exercise pilot. In 48% of cases, no invitation was issued because they thought my patient was too frail or perhaps the treatment too intense. 28% of our patients participated in this trial, and the average age of those invited to participate was younger than those who were not.
Weekly group exercise sessions consisted of strength and aerobic training. Strength training targeted 5 major muscle groups followed by aerobic training. Participants were also encouraged to exercise at home. The attrition rate, using the definition described in our paper, was 24%. The compliance rate was 73.1%. Our patients improved their 6-minute walk test by an average of 75 meters at 30 weeks. However, we did not see any change in the quality of life or fatigue scores.
Beta-catenin is a mediator of the Wnt pathway. Wnt plays a key part in colorectal cancer carcinogenesis as well as energy metabolism. Wnt signaling is controlled by an APC-containing destruction complex which regulates beta-catenin. In colorectal cancer, mutation of the APC gene disables the destruction complex and leads to accumulation of beta-catenin, which goes to the nucleus and promotes transcription, leading to increased cell growth and carcinogenesis. Survival of metastatic colorectal cancer patients exercising in our program and those who did not was the same, as suggested by the Kaplan-Meier survival curve with a hazard ratio of 0.98. We then looked at patients with metastatic colorectal cancer with weak nuclear staining for beta-catenin. We compared the survival of patients exercising in our program and compared it to those who did not. The hazard ratio was 0.39, suggesting weak nuclear staining for beta-catenin predicts for improved survival with exercise for patients with metastatic colorectal cancer.
So in conclusion, patients with metastatic cancer on chemotherapy can exercise safely with improvements in fitness, however not necessarily quality of life nor fatigue.
And we have a possible biomarker for exercise-induced improvements in survival for patients with metastatic colorectal cancer. The next step is a prospective clinical trial.